to protect themselves, and really helping understand the entire disease and how it progresses and what works in it. So thank you very much for joining us.
Amos, thank you so much for having me.
And guys, if you hear a disembodied voice, that is not God, it's Oz in the control rooms. So he might join in and ask something. If you guys wanted to ask any questions, you could probably do so in a super chat. But today we're very tight. We have the debate coming up, so we're going to have to pretty much move along. So let's, without further ado, jump into our first topic. So guys, if you are not interested in the political debate, I would nevertheless recommend that you stick around, because it's going to be very valuable information in the second segment. So, Dr. Baxter, I was trying to understand the progression of disease and how it reflects on Trump's timeline. Could you tell us a little bit about how the disease progresses?
Sure. Well, there are 4 clinical stages to COVID-19. The first is after infection, when the virus is incubating. So during that phase is dark blue on your screen. The virus is replicating and spreading, as they say, virally. After the virus has gone from entering through the nose, it's replicated, it turns on the ACE2 receptors other places in the body so you can get the disease more widespread, that's when the lungs become involved. The receptors inside the lungs aren't actually activated initially, so that's why it goes in through the nose. You get the lack of smell, you get the headaches, you get those kind of very specific but not too annoying symptoms. And then once that's been going on for about 5 days, that's when the lungs start to get too involved. So that's when you start to develop the cough, the shortness of breath, and then oxygen levels start to drop. So in this particular instance, those are the first 2 phases, and then the third and fourth phase are when there's severe pulmonary involvement, and then the immune cascade that causes the blood clots, that causes the strokes, that causes the cytokine storm, and all the other really damaging things that go along with coronavirus. There are 2 possible scenarios here, because the course that the president has had doesn't exactly fit either one of these. One of the most rock-solid parts of the course is that symptoms usually start occurring on day 5 to 6, and people are most infectious 2 days before that and the first day of symptoms. So that set of facts would seem to support that he began having symptoms on Wednesday, Thursday. He certainly was having symptoms Thursday. He was raspy on Hannity. His staff said that he didn't seem well on Wednesday. He seemed down and more tired than usual. Fatigue is certainly a common symptom of coronavirus. So with that set of symptoms, you'd say, okay, well, if he started really having symptoms on Wednesday, Thursday, then that would mean that he was really infectious Monday, Tuesday, and he was likely to actually catch the virus on Saturday. There's another way to interpret what we've seen that's more based on how much we believe the reports of his low oxygen levels. Typically, you're not going to start getting pulmonary involvement that's going to actually drop your oxygen levels until around day 10 or 11. So if that were the case and you count backwards, then he may have had loss of sense of smell and headache on Saturday and Sunday, and was able to not have coughing during the debate, but was actually pretty sick and having oxygen issues by the time he hit the hospital. In which case, that would have made him the super spreader on Saturday. One new pre-release paper found that there are 4 different characteristics of super spreaders. The people that have so much viral load in their aerosols and respiratory droplets that they account for about 80% of the coronavirus cases that are transmitted. And those characteristics are obesity, old age, speaking loudly, and or singing or laughing, and being ill. So if, in fact, Trump were ill at that time, he would be the absolute classic poster child for a super spreader. And we certainly know somebody there was spreading.
That's interesting. That's the first time I've heard that the age can also predict how much of a hazard you are to others to spread the disease.
It's one of the preprint articles, so came out about 5 or 6 days ago in medRxiv, meaning that it hasn't yet been peer reviewed. But I and many other scientists who review for the NIH, we do science, we are called upon to do peer review all the time. So even if it's not in our area, you can tell whether or not the study's designed well and if the statistics look reasonable.
Could we conclude anything about his spreading ability once he got out of the hospital? Is it at that point, does the viral content die off, or is it still pretty much out there?
Well, the CDC currently says that you are potentially infectious for 10 days after the resolution of your symptoms. Problem is that dexamethasone is extraordinarily potent at suppressing symptoms. So we don't really know what is going on with his symptom level because he was given steroids in the hospital and is presumably still on steroids. The current protocol is to give 10 days of 6 milligrams of Decadron, either IV or oral. It's equally bioavailable. So Decadron in about 30% of people causes psychiatric symptoms. Mania is the most common. Depression is possible. Certainly, he's not having depression. So it's not uncommon. In fact, Jane Pauley, who's on the Today Show, she had a dose of steroids for an itching condition, and she ended up being hospitalized for 3 weeks with mania in a psychiatric hospital. So no family history, just purely related to the steroids. So he's getting a higher than normal dose of steroids. He's getting, we don't know how many days because information has been cut off, but he at least got 3 days of Decadron, and I'm betting he's going to get at least 5. And this suppresses fever. It suppresses even the symptoms of pneumonia. There are actually studies that find that the initial symptoms get better, but as soon as the Decadron goes away, if there's still virus there, it rises up like a flame and absolutely decimates, because what Decadron also does is it suppresses your own immune system. The analogy that I like to use is that when you're getting ill, that's when you want your immune system to flame up like a campfire that you're trying to light with a flint. So you're doing everything possible to raise up the quality of your immune system. But once coronavirus starts kicking in, once the COVID-19 symptoms get bad, it can trigger off a cascade for a number of different reasons. They think now it's more a bradykinin storm rather than a cytokine storm, but the bottom line is that your normal systems for attacking disease start attacking yourself. That's why Decadron, which is the flame equivalent of a Chinook helicopter dumping an entire freight train worth of water on your immune system, that's why Decadron's great if your immune system is already going haywire and you need to put the fire out. But if you haven't really gotten that sick yet, you need your own immune system to actually stamp out the virus. And that's what we just don't know, where he was in the viral creation period and what his symptoms actually were.
And that's quite amazing though to think about. Could we conclude that his condition was quite severe if they attempted to give him an experimental drug that has been tested maybe on a handful of people aside of him? I mean, that seems to me to be kind of an extreme thing, and also in general, just using the steroids at this point, would that suggest that his condition was perhaps more grave than they would let on?
Well, we really have to break down each of the 3 experimental or quasi-experimental drugs we're talking about here. So remdesivir is an antiviral, and it is not, so it is something that hits one of the mechanisms that the virus replicates with, so it stops the replication of the virus. So in theory, you get lower loads of the virus. thus far, clinically, it has helped a little, maybe. It's not got really robust data around it. It certainly doesn't have any data that shows that it harms, but it's not the cure-all that we were hoping at the beginning. Now, the next one is the monoclonal antibodies that Regeneron do. Okay, yes, it's hyper experimental. There's only 10 people who have gotten it. But the science of making antibodies is very well established. The concept of how you make an antibody that's going to be tailored to fit to the ACE2 receptor and the methylated edges of it, that actually is, it's new, but it's well established on how you do it. So while it is experimental and needs to be tried, the risk with it is really low because we know what antibodies do. Antibodies will grab the viruses and knock them out. So antibodies are in the game Galaga, and you're ping, 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 and you're shooting down all the viruses that you find, whereas the remdesivir is just trying to make the ships not create more and more viruses. I don't know why I've got these 80s video game references, but that, so I'm actually not that concerned about the antibodies from a risk standpoint, because even though it's very new, it makes sense that it'd be effective and the technology is safe. The interesting thing is that now today, Comey's doctor, his doctor said he's got antibodies. He tested positive for antibodies. Well, duh, because they gave them to him. So of course he's going to be testing positive. He's testing positive for IgG, and the typical influx of when IgG becomes detectable is about 18 days after the acquisition of the virus. So either it was way earlier than anybody's saying, or much more likely the reason he's got antibodies is because he was given them, and so they are triggering the test. The first antibodies would be a different one. There's different pathways, and IgM is the first antibody that shows up. I'm really interested to know whether he has that, because that would show that his own immune system is kicking in, and that also, if he really did have IgM, again, that would establish that he's had the virus for longer than we're being told. Now, the critical question that you're asking, and all the doctors are asking, is, was he sicker than we thought for him to get Decadron? I think that it's much more likely that his very young doctor and the team were bullied by Trump himself into giving him a drug at the wrong time in the cycle, and it was not actually clinically indicated. The current clinical indications for Decadron are that it only helps reduce death when it's given to intubated patients, and one other study found that patients who were in the ICU but not yet intubated also had a lower death rate. However, when patients had oxygen only, there was a much smaller decrease in death rate. And most critically, multiple studies find that patients who were already on steroids, or patients who were given steroids when they didn't require continuous oxygen, they are 1.19 times more likely to die. Now, that particular one from the recovery study in London didn't reach statistical significance, but if you look at it as a trend, it was statistically significant. So I think that, again, the likelihood that he was on continuous oxygen and close to critical care is really low. It's much more likely that the doctors were afraid to withhold it from him and he wanted it, so he got it.
Mm-hmm. Okay. All right. Well, let's also launch into the second segment where I hope we can give the viewers a good set of precautions and safety tips that they could use. So the first one was outdoor versus indoor, and I don't know where that figure comes from, the 90%, but there was claims that there's a big difference between the number of people who get it from indoors and outdoors.
There's a new study in Germany that I have not read yet, but I would be willing to bet it's actually higher than 90% of patients are infected indoors. If you look at some of the work from Japan of respiratory droplet and micro droplet dispersion, even being inside a room and opening a window makes the particles so dilute that you can't get a critical mass in your nose to establish the viral inoculation that you need to be able to go on to have symptoms. There are a couple different studies that support this type of logic. One is by Gandhi at UCSF, and what they found was that when mask wearing percentage goes up, the number of asymptomatic people goes up. And that implies that, again, you need to have a critical mass of virus in your nose. And if you're outside, if you're masked, you're just not going to get that. We didn't see spikes of cases after the rallies for justice. We didn't see rallies causing this, the protests rather, and the outside rallies that Trump held also weren't accompanied by big spikes. Indoor rallies, big spikes. Herman Cain passed away. I mean, so it really does make a huge difference outdoors versus indoors.
Mm-hmm. So it's all about the viral. It's all about the viral load.
It's all about the viral inoculation. Yeah, I mean, like how much virus you have in your nose when you go to the hospital is predictive of death. How much virus you get in your nose at a time is correlated with asymptomatic cases. There's really a strong correlation. And it also seems like it's not as much living in the same household over time that you get exposed to it. It really seems like it's more of one big dose. And so you're more likely to get that one big dose living in a household with someone who's sick than you are over time.
Okay. Now, number two was something that was actually published by the CDC recently in the last few days, where they actually admit that it's probably not a good idea for you to go and dine. Now, the study didn't distinguish between indoor and outdoor dining, so it's kind of difficult to make conclusions strictly on that. But nevertheless, the people who did dine out, of the people who tested positive, 2 times more dined out in the last 2 weeks, as opposed to the people who did not.
Yeah, but that is Morbidity and Mortality Weekly put that out about a week and a half ago. And again, like you said, they didn't probe to ask whether people were indoors or outdoors. And they had bars and coffee shops, which were higher risk, and they had eating out as its own risk category. But it's enormously different if you're eating outside, or if you're in a closed room. I mean, some of the first earliest cases that gave us a hint that this is an aerosolized infectious disease rather than a fomite or touching kind of disease was an indoor restaurant in China where the air didn't recirculate. It didn't bring in fresh air, and you can actually see the pathway by which the air conditioner blew the virus indoors, but it didn't get circulated out. So that study, to me, you cannot tell whether eating outdoors is dangerous or not.
I would at least for myself, I would stick with outdoors at least.
Oh yeah, I would never eat indoors, but I've been to eat outdoors many times since this started.
Mm-hmm. Okay, and number 3, switch to number 3. So breathe through your mouth, not through your nose. That's a simple tip, isn't it?
If you can remember to do it, it's a simple tip. There's a lot of prejudice against mouth breathers, so you've got that. But what I have decided to do, once I read the literature about the aerosols going through the nose, once I read the literature about the ACE2 and TMPRSS2, you got to have both receptors activated. They're almost all activated in the nose. I went out and bought about 6 packs of Swimmer's nose clips, so that if I am someplace where I cannot remember to breathe through my mouth, or if I'm not sure, I just put this on. I try not to talk and sound nasally, and then I put it under my mask, and nobody needs to know. But yes, if you're in an elevator, if you're in someplace where you don't have precautions and someone else gets in, breathe through your mouth, not your nose.
Okay. Next one, number 4. Number 4 was, let's see. So the nose irrigation.
So this was a theory that I happened upon, and I started wondering why people in Southeast Asia had lower case fatality rates and lower attack rates for SARS-CoV-2 than in other countries. And particularly, you could say it's all masks or it's lying and not doing handshakes, but we know now the handshakes are probably irrelevant. But there were several countries in Southeast Asia that had lower rates than the Korea, Japan, places where they do wear masks. What could possibly be the difference? It turns out that in Laos, Thailand, Cambodia, Vietnam, they do nasal irrigation as part of their normal hygiene routine. Nasal irrigation, people may have heard of a neti pot, a sinus rinse. If you listen to Sirius XM, you're hearing about Navage all the time by Martin Hoke. So what it is just taking saline and flushing it in one nostril, out the other. It's an Ayurvedic tradition. It comes from India 3,000 years ago. Seems like they may have had something going on. There are studies that show that just with flu or general colds, you can decrease the duration of an illness by about 2 days. COVID is beautifully positioned to be responsive to nasal irrigation because it takes a long time between inoculation and development of symptoms, because we know it enters through the nose and that's where it's building, but also because these receptors that the SARS-CoV-2 attaches to are on ciliated epithelia. This means that they're on wiggly, wavy little parts of cells that you might remember from your biology class, but it's not an easy slam dunk pocket that the virus goes in. It's going on to this precarious perch. So if we have something that flushes it out, it makes sense that it would do a good job to decrease the amount of nasal particles that are infected.
That's good. So what's your theory of what is behind it? Like what is it? Is it just basically?
Well, there's two things. There's a bunch of things. First of all, in general, the mucus in your nose is remarkably adaptive. It changes dramatically based on pollution, based on pollen levels, based on even when you've gotten a vaccine. This is one reason why we think that getting a flu vaccine and certainly getting a BCG vaccine may be protective against other viruses than the ones you got it for. The flu vaccine and the BCG, which is a tuberculosis vaccine, they may change the mucosa in your nose, making it less likely that the virus can get in. And it's not just coronavirus, it's any virus, but the COVID-19 virus, when it goes into the nose, when your nose is drier, you have breaks in the mucus, and the SARS-CoV-2 can go directly and land on the receptors. If your nose is well hydrated, then the mucus actually serves as a decoy, and so the virus hooks on to some of the mucus and then is expelled. So one way that this can help is increasing the humidity of your nose and making sure that there's no breaks in the protective environment. And the second part of it is just flushing away any virus that does happen to get attached.
Okay.
Now, mind you, there are a lot of things that I will talk about that are evidence proven or evidence based. Nasal irrigation for coronavirus is a theory. We know that it did decrease duration of illness for other coronaviruses, but for COVID-19, there are about 12 groups right now that are studying various forms of nasal sprays, nasal irrigation, nasal vaccine, and looking at viral load, looking at prevention, looking at decrease of symptoms. So my study, which we started in Augusta, Georgia, about 2 days ago, we're looking at nasal irrigation to decrease the rate of hospitalization in people who are COVID positive. But other people are examining different things. We should have answers within a couple of months from some of these studies.
Okay. We should speed up. We have 5 more minutes. So the number 5 is the supplements that you can take. And you mentioned a few. There's vitamin D. Dr. Fauci's was reported to have been taking 150 micrograms, which is 6,000 international units. As far as I know, vitamin C, zinc, uh, statins, apparently they also help, according to you, and melatonin, baby aspirin, and quercetin. Do you have anything to?
Just to say quickly that vitamin D is one that is highly associated with increased death rates, increased illness, but only if you're vitamin D deficient. So many people are, and that's a reason. There's no real harm in taking vitamin D, whether you're deficient or not, but it's not going to help if your vitamin D levels are already good. The one other thing I'd add to that list is magnesium. Magnesium is a natural anti-inflammatory, and if you get COVID-19 and become sick enough that your immune system is starting to cascade, magnesium and having good magnesium levels is correlated with lower risks of cytokine storm. So adding that to the regimen, personally, I take D, zinc, quercetin, and melatonin, but when I think about it, not necessarily every day, and magnesium.
Okay, and I was surprised to find quercetin there, which I take for other reasons. And there's certain foods that contain quercetin: cherries, green tea, coffee, red wine, capers, apples, and broccoli, stuff like that. And I understand that helps not only for the viral aspect, but also for the cytokine storm prevention in the second phase. Is it? Am I correct?
I don't know. I actually don't know that. I only know about the antiviral part. By the way, there's one question: will spraying Lysol on surfaces protect against COVID? Nope, because there are no documented cases where touching something and then licking or sniffing, or maybe if you shove it up your nose, but touching surfaces is not how this one spreads.
Okay, let's go to number. Yeah, let's go to number 6. Number 6 is the avoid taking steroids in the first stage. Do you want to
cover that one? Yeah, we've well addressed that.
Yeah. Okay. Number 7, cross ventilation. Germany officially has now erred on the side of increasing ventilation as one of the efficient, effective precautions, and it's probably a good idea.
Yeah, the numbers that I'm looking at in the calculations are you want an air conditioning system that will replace the volume of air in a room 10 times an hour. And certainly if you have cross ventilation, you're going to well exceed 10 times. So that makes a ton of sense.
Okay. Number 8, we had masks. So, of course, masks protect you as well, not just the surrounding. And and that's perhaps the most effective tool you can take. Is that correct?
Yes, and it's fashionable. Yeah, the thing about masks is that we're definitely learning that there's something called virulation, which is sort of getting the disease just a tiny bit, so that it's almost like your own mini vaccine before we have a vaccine. And so this was done with smallpox, when people would take a little bit of the pus from smallpox and rub it on an open sore just to get a tiny bit, but not too much. It's a poor vaccine, but it's the same principle as a vaccine. So variolation is what it's called. And wearing a mask means that if you're in an area where there are COVID aerosols around, you're more likely to just get a small enough dose of it in your nose that you have an asymptomatic or an extremely mildly symptomatic case.
All right. So basically, we have in the links also some information about making your own, because if you don't have an N95 mask, you can make your own, which is actually supposedly better than an N95. The way masks work is basically it has filtering on a physical level and on an electrostatic level. So the physical level is for larger particles. The virus actually is at a smaller size, which is filtered electrostatically. So they looked at efficacy of different materials, and in the study, if you look in, if you check the numbers. The cotton itself, sorry, N95, if you wear it without any gaps, and the gap could be like a millimeter around your nose, it has to cover you very snugly. That's the most important part. If you look between the N95 with a gap and without a gap, there's a huge drop where there's a gap. And secondly, the two-layer system appears to be working best. You have a cotton layer, which is 600 thread count or higher. You can get it from a sheet. And then the inner, the second layer would be a chiffon, which is 97% efficacy in filtering electrostatically. And that combination helps. You can even improve on that by coating your cotton with acetic acid, which also is an antiviral, from what I understand. So there's links in the
It's just vitamin C.
Yeah. There's links there, and thanks, Brent, for your donation.
Go for it, Brett. Yes, you can get your favorite Mediterranean restaurant extremely safe. There are no known cases of transmission through food.
Great. All right. So thank you very much for joining us and clearing all these points. That was very valuable and helpful. We have our next show is going to be about white supremacies, Boogaloo Boys, and alt-right. Oh my! And I'm hoping we'll get some interesting guests regarding that. Remember, you can tweet to us. You can support us and share our content to anybody who you think would benefit. All right. Thank you very much. Thanks, Dr. Baxter.
And real quick, if you want to get a flu shot, Buzzy is a device that I make that blocks needle pain and is FDA cleared to reduce pain. And we're applying for the FDA indication for reducing fear, because we've got about 50 papers that it reduces pain and fear for vaccinations.
Oh, that sounds interesting. I'll check it out.
BuzzyHelps.com, paincarelabs.com.
Thank you very much.
Thanks.
Bye-bye.
Yeah, Amos